Assalamu alaikum, you're watching Views and News and I'm Faisal Rehman live from our Islamabad studios. Today we'll be talking about the current situation of COVID-19 in Pakistan. As we all expected that the third wave might come, it has already arrived. Now, when you talk about corona or COVID-19, that particular virus, it has mutated and the new constraint is very, very dangerous now. It's very powerful. A lot of doctors believe that this is the one which has come from UK. Now, the overall condition as far as today is concerned, there were 2,253 cases reported. Half of them were from Punjab. And when you talk about the overall deaths in the last 24 hours, the recorded number is 29, out of which 16 people were on ventilators. Now, what I'm saying is that unfortunately, the public is not taking it seriously. Yes, it is a very deep concern. It is very hard to be doing social distancing or physical distancing for a year, to stop attending the weddings or stop going to the funerals for that matter. A lot of people are working from home. Yes, these are the SOPs we need to undertake. But having said that, the real SOPs are the ones where you have to keep your hands clean, keep washing them, keep cleaning them with the sanitizers, cover your mouth, your face with a mask. Do not take it off when you are in the public places. But unfortunately, we did not follow the SOPs and now the condition is getting worse. Having said that, the total number of people which have been killed so far, the number is well under 10,000. The people who got infected, it's well over 650,000. I'm talking about Pakistan. And when you talk about the availability of the vaccine, as we all know, today, the President and the First Lady, they got vaccinated. A lot of other elders are also getting vaccinated. 1166 is the number where you get yourself registered. But talking about it, National Command and Operations Center has advised the provincial administrations to take strict actions on violations of COVID-19 related SOPs. It further states that the Singh government has imposed new COVID-19 restrictions in the province till April 15th. The Punjab government has imposed a lockdown in 7 high-burdened cities of the province, restricting movement of the people to their homes following intensity of the third wave of the COVID-19. It says the district administration has imposed smart lockdown in 4 localities in Peshawar after surge in COVID-19 positivity rate. And it further adds that according to Punjab Health Minister Dr. Yasmin Rashid Saiba, over 18,000 people of 60 years and above have been vaccinated in the last 3 days. The minister highlighted that during her visit to the Expo Centre Lahore, along with Special Assistant to the Prime Minister on Health, Dr. Faisal Sultan, to monitor vaccination facilities. And there are a couple of tweets also by the advisor to the Prime Minister on National Health Services, Dr. Faisal Sultan Saab, who is also a coordinator in the infectious diseases. He says that COVID-19 infections and hospitalizations in Pakistan are increasing once again. The decline seen over the past 2 months is clearly reversing as positivity rate has gone up from 3.31% to 4.16% within a week. And in Islamabad, it was 6.6%, by the way. We must remember that the pandemic is not over. He further says that I visited Expo Centre Lahore today to get my father vaccinated for COVID-19 and process was seamless. I urge everyone 60 and above to register for the vaccine by sending their CNIC to 1166 and get vaccinated now. You know, when you get yourself registered on 1166 through your mobile phone, and if you're 60 years or above, they will send you a date and time and a location where you have to go and you get yourself vaccinated. In certain cases, you'll be vaccinated twice. There'll be 2 injections given to you within a span of, I guess, about a month or so. So primarily, this is what the current situation is, and it is not at all good. To talk about it, let me introduce you to our panelists. We have with us in our studio on my right is Shaukat Paraja Saab, senior journalist, anchor person. Thank you so much, Paraja Saab, for your time. And we'll be talking to Dr. Numan Zafar. Dr. Saab is a senior physician based in United States of America, but currently is in Pakistan. Thank you so much, Dr. Numan Zafar Saab, for your time, sir.
Thank you very much.
And we have with us Asim Shaukat Ali Saab. He's the spokesperson of Punjab government. Shaukat Saab, pleasure to have you in the show, sir. Thank you so much. And we'll also be talking to Liaquat Shahwani Saab, who is the spokesperson of Balochistan government, and we'll be getting the update from him regarding what the current situation in Balochistan is. But putting the first question to you, Shaukat Saab, looking at the numbers, they are alarming. But looking at the behavior of the people, that's even more alarming. We used to wear the masks, and a lot of people used to do, even in offices, in bazaars, or in markets, or in otherwise. But you hardly see anyone following the proper SOPs, sir. Your take, Pracha Saab.
Thank you very much. And I think despite the very hot political atmosphere in this country, I find it very appropriate of your choice that you're talking of something which is, I never thought has a recurring threat, rather it's a threat, you know, and prevailing threat in not only in Pakistan, elsewhere even, you know, all over the world, you know. And you are right, the behavior of the people has been very strange, and it has been so from the very beginning. Last year when in March, this month,
exactly
you know,
the
same month when a lockdown was imposed, people got outraged that why you have closed shops and markets, and since then we've been suffering losses. I mean, on 26th of February, first case was detected in Pakistan, and now within a year, you know, it has number has gone up. There was a curve downward, but again it resurged, and resurged because of our attitude that we were so desperate to go for the weddings. You have seen last year Eid ul-Fitr, how, you know, people were making rush in the markets, Lahore, Karachi, Rawalpindi, Multan, Faisalabad, everywhere, you know. The attitude problem has been two-pronged. The one is, the one has been, we never accepted COVID as a reality. From the very beginning, there were many, you know, conspiracy theories that it's something man-made, it's not natural, and there is some particular conspiracy behind spread of this China versus United States and Muslim world versus non-Muslim world. So it became a kind of, you know, a divergent scenario. Some segments accepting, creating awareness, you know, that this is, you know, sanitizer and I am having my mask, just I removed, you know. The other segment was saying that no, why you are creating panicky among the people. And then, you know, with the advent of second wave, people got more conscious. Some reality is there. And now again, you know, the second aspect of this is that first we waited that there should be vaccine for everyone. When vaccine was here, even the health practitioner, they refused to get it, you know. To me, very strange phenomenon that doctors, nurses, paramedics.
It wasn't the confusion that was prevailing, sir. People were not certain about.
That's what I am saying. You know, the confusion that started with this, you know, otherwise the reality that still prevailing, you know. And in Pakistan even it also became a political tool, you know, federal government versus provincial government of Sindh, Prime Minister saying this is the elite which has been advocating complete lockdown, and province saying no, we had a first, you know, choice, then federal government did not, you know, properly respond to Karachi airports or Tuftan, you know. So whatever the conspiracy theories were, they changed into a differences on political grounds, you know. But still, you know, when NCOC is meeting, the province and the federation or the federal government or the provincial government, so far they have been on the same page in terms of implementation of whatever the
rules or regulations
or mechanism has been adopted. But very strange behavior from the medical profession, practicing people, and similarly from the people, you know. A survey recently revealed that out of every 5 person, 2 were not in favor of having vaccine. On the other hand, we were sometimes criticizing the government that the government is lethargic, government has not given proper order and has not been able to import vaccine in time. But when vaccine is there, then, you know, there are controversies, there are the reluctance, you know, not only from common people, but even from
the educated people
the
also.
Educated people, you see. And this the difference has not been in one society. In the neighborhood, India and Pakistan, for example, I remember SARC, health ministers met when Modi, Prime Minister Modi, invited a meeting in the beginning, then last month, again a meeting, but still there has not been a cooperation in a way that disaster in one, country could help out the people in the other country. It could have been between China and Pakistan.
And India
for
is one of
example.
the major vaccine producers at the moment.
There
sir.
was
They're
a news
exporting also.
item. There was a news item that around 4 million or 1.4 million jabs they will be sent to Pakistan via some third party mechanism, Javi, for example. But it was not confirmed from our side, Indian newspaper, the Indian media published this report, but I could not get it confirmed from here. However, when the recent meeting last month, when Prime Minister Narendra Modi again chaired this meeting, and it was attended by Dr. Faisal Sultan from our side, there were some agreements. I'm understanding, not agreement in that technical term, because diplomats are watching, and agreement is something, some understanding was about air service, for example, for the medical people, relief activities, but I have not seen it on the papers so far.
Okay. But at least one thing is for sure, that this is a reality. It is going to be there, and the new norms, they will be in place. Simple as that, sir. Because when you talk about wearing a mask, I think that is a part and parcel of.
Actually, the reality is very strong. I mean, if one person is caught up, then entire family is at risk.
But Acha, one of our very dear friend, she is an MNA from PTI. Her brother, mother,
exactly,
bhabhi,
exactly,
3 of her kids, they are all sick.
All sick.
So you can well imagine ki if a kid is a carrier, comes home,
exactly, everyone.
and if you have elderly at home, that is where the problem
is. If one house is infected, then
everybody is going. Exactly, and this is what is happening in I8, in a couple of other areas.
F11,
even F11-1.
F11,
yes,
exactly.
Now coming to you, Dr. Saab, since you have been in USA, you have been monitoring it very closely, you have been treating the patients, and the last time we got to talk over the phone, you told me that you got vaccinated and you have developed the antibodies, and you are here in Pakistan to attend a wedding. But you were surprised to see that nobody was following the SOPs here, sir, in Pakistan, and especially in a city like Multan, which is so big, where there is a lot of awareness, a lot of educated people live there, and especially when you talk about the people related to the medical profession, I mean, they outnumber most of the cities, sir. What have you seen so far?
Thank you very much, first of all, for me being here. Yes, actually, it's very, very interesting phenomena what's going on in Pakistan. I mean, I got vaccinated, I got my antibodies, and thank God I waited for the antibodies to develop and reach Pakistan. So initially, for first couple of days, when I saw in Multan, Vihari, Faisalabad, Lahore, I would say like less than 1% people were wearing masks. I myself start thinking maybe there is really no corona going on here, and that's why people are just living a normal life. But honestly, within the next few days, my whole process just changed. So I met one person, I met one of my very close friends. They were visiting me at home, and obviously without a mask. And he's explaining to me that he has his like one of the family member is positive, and he was with him for last 48 hours. I said, no, you need to be tested. Obviously it looks like a joke to them, but I am carrying myself actually the corona like a small machine. I can even show you. This is like, even it's good for the government to see actually. This is a very small piece of equipment. It's a nucleic acid amplification. It's not an antigen. You can have an antigen machine which is cheaper, but this is actually equal to actually a mini PCR. So I had that machine with me, and I said, no, I need to test you right now. So I tested him right away. It takes about 20 minutes. You put you take a swab, you put this in the cartridge, and you insert the cartridge in the machine. And it just takes 20 minutes. He's positive. And I said, oh my God. So I have to after that, about 4 or 5 people every single day, every person I'm talking, they are actually, they are with fever. They're with fever, they're with cough, muscle aches. But the whole point is, the people, when I tell them we need to get tested for COVID-19, the response is like I'm joking with them. I kept explaining everybody, this is See, oh, this is just a sore throat. This is just a fever. I said, this is not just a
Yes,
fever.
exactly.
We don't
Exactly.
have flu going on right now. We don't have a strep throat going on. We have in the market, we have COVID-19. So if you're sick, I mean, this is there is a high chance, about 90-95% chance this is COVID-19. But the problem is, I mean, the young people, they get sick for a few days, 5 days, 7 days, they get better. The problem, again, what you have said before, that when they go home, they take it home. And their parents, grandma, grandpapa, all, they get infected. So I think for Pakistan right now, means first of all, we have been talking for a year about on this, the mask. I mean, literally, I was in Multan, one of the market, just went for an hour before at like 6 o'clock, and police was there to do the early shutdown, and people were fighting with them. I've literally seen and actually had made a video of it. The people were fighting with police that why you're asking us to shut down the shops. So, I mean, the point is, people are still not understanding. And on the other side, to reach the herd immunity, we need to have 80% of our Pakistani people either
Vaccinated.
vaccinated or had an infection. Means the way I looked up means for last 1 week, the infection is there and it's a good amount of infection. Whatever the numbers we're getting, in my opinion, they are 10 times less than what we are actually reporting, because all my friends, whoever I called, like a lot of other people, their families were sick. The first question I asked, did you do testing? No. So the important part is that we need to have testing. I mean, I understand their point of view that this is a
I'm sure,
60.
Dr. Saab, the most important part is about the capacity of testing. That is there, but 40,000 is nothing for a country like Pakistan, where you'll see the population is around 220 million. But Dr. Saab, one quick comment before I go to Asim Shaukat Ali Saab. Tell us about this new variant, sir. Is it stronger than the previous one? What exactly is it, sir? This UK constraint.
Yes, definitely. The UK strain, the Brazilian strain, the South African strain, all the three strains means they are more transmissible, and the vaccines does not work as good as compared to the older strains. But still, we need to be vaccinated, because if we have, for example, high amount of antibodies, even if we get a UK strain, then if we have enough amount of antibodies, the antibodies will work against the strain, and it will not make you sick, or at least it will actually prevent getting really severely sick. I mean, you can see me. I mean, I have got Pfizer vaccine. I got antibodies. I am directly exposed like 6 days ago with my friend without mask, and this is called an exposure. And I had a little bit of sore throat over the night, honestly speaking, but then literally I was fine. So I have my own machine. I keep testing my COVID test daily, kind of thing, and I'm negative. So it means there was a genuine, real test of the vaccine. I got vaccinated. I had antibodies. I encountered a COVID patient. I did not get it. So it means the vaccine works. So even if it's a UK variant, this is more dangerous, and that's why you see a lot of restrictions in UK actually. So we have to be, means the testing has to be readily available. Means, Faisal bhai, one important thing is, I think somehow or the other, I would request the government, if it is possible, to decrease the price of the test. If people have 5 people in the house and a 6,200 rupees test, people will not spend
Exactly.
30,
That is
35,000
the
rupees.
major problem, sir. Technically speaking, it should have been free for everyone, so that you can get more people tested, and then you will be able to understand the magnitude of the problem. Now, coming to you, Asim Shaukat Ali Saab, talking about Punjab, half of the cases during the last 24 hours were reported from Punjab, over 1150. Now, what I'm saying is these are the reported ones, and I'm sure the actual number is much more higher. What I'm saying is, sir, when you talk about the SOP, certainly the government thinks, okay, this needs to be done immediately. Don't we have a proper plan that say this is going to be there for another 6 months, perhaps a year or something? These are the SOPs which should be in place no matter what. I mean, it seems that certain elements are missing from the government side, and as far as people are concerned, they are not responsible at all. So these two make the problem for those who are actually following the SOPs, sir. No matter how many masks I wear, how many times I clean my hands with these kind of sprays, but if somebody else who is even not carrying is still a potential threat, sir. Your take?
Faisal, thank you very much. It's a pleasure to be with you on this show. And my special regards to Shaukat Paracha Sahab. I'm his great fan. And thanks to Dr. Numansa. 3 things. I have been saying in several programs, this is the high time that we as a nation should learn that now we need to learn to live with this virus. This is good that if we get vaccinated, and as Dr. Saab has just said that vaccination really works. I was thinking that we should get his statement recorded and we should play it occasionally on media. That yes, there are so many myths, there are so many conspiracy theories, there is a lot of disinformation about the vaccination, which we need to remove. Media has to play its role. Clerics, politicians, and all the responsible sections of the society have to play their role to make people educate, to let them know that there is nothing wrong with the vaccination. This is a need of the hour. We have literally tried very hard to get the reasonable amount of quota for our people, and we are doing it for free, just for the sake of the betterment of our people, and it must be commended. And we have made extensive arrangements throughout Punjab and throughout the country. We are trying our level best to vaccinate people just to protect them. But at the same time, this is equally true that people are exhausted. Their stamina is exhausted. Number one, we are living in such a region of the country that we are very thickly populated. It is very difficult for the people living in downtowns to maintain social distance in their homes, in their streets, in their areas. And secondly, in downtowns, people are not taking it seriously. You have very rightly remarked that every single person out of 2 people think that there is nothing like corona. Initially, we had to face this dilemma that people were of the view that there is hardly anything that is corona. And now we are facing different sort of problems when we are trying to vaccinate people. Someone says that they are trying to spy on you. Someone says that they are trying to inject some chip inside you. Someone a few days back, I was listening to some cleric, and he was a religious person. He was saying that it is trying, if you get vaccinated, you won't be able to become pregnant, specifically for the ladies. So these sort of disinformation was being spread. Another thing, 38% of the population is on social media. There are so many fake news on WhatsApp, on social media, on Facebook and other things that these sort of vaccinations can play havoc with your life. And so much so, as my elder brother Shaukat Paracha Sahab just said, that paramedical staff, even doctors were a bit scared that they might play some havoc with their lives, or they might be having some negative effects on their health. But I assured you that we have procured the best possible vaccination available from China, from Russia, from Oxford, AstraZeneca, from Sputnik from Russia, and Sinopharm from China. So, but Faisal, one more thing we need to understand. We are on a very tight rope. This is just like as you have to decide between the deep and the devil's sea. If on one hand we have to protect people from the virus, at the same time we have to protect the people from the hunger. There is a huge economic pressure. I have been sitting myself in different meetings with the traders, a different meeting with the market organizers, and with the different business groups. You can't imagine what sort of pressure they are going through. There are approximately 2.5 crore families which are daily wagers, and approximately 13 to 14 crore people which are dependent on their daily wager workers. If they do not work in the morning, they won't be able to eat in the evening. So if you remember, Imran Khan, when we had a first wave, Prime Minister Imran Khan was adamant that he will not enforce a complete lockdown, because he understood that our economy cannot, that people in our economy or the people in the lower belt will be crushed. So God helped us, and we offered an option of smart lockdown in various areas of the country, and it worked. And now, yes, I repeat that Allah helped us, and it was the intentions of Prime Minister Imran Khan. But now again, we have been struck again with a very lethal or mutant virus that is from UK. People need to learn that now they have to learn to live with this virus. Masking,
I totally agree with you. I totally agree with you, sir.
Yes.
Even
and
when you
social
talk about,
distancing.
even in Italy, sir, half of the Italy is under this strict, or you may call it, smart lockdown, as you said.
But
the
Faisal,
point is now, sir,
the scale of economy is different now. We have
Yeah.
a very complex economic system. This is the problem, and we have a very big population. I have just given you the statistics that approximately 13 to 14 crore people are daily wagers, sort of. If they do not work in the morning, they won't be able to eat in the evening. So this is the biggest dilemma. When I go to someone and when I tell them to shut their shop at 6 p.m., literally, Faisal, I tell you honestly, you cannot imagine the plight I can see in their eyes. They are ready to fight with us. They say the cultural norm is that people, after finishing their offices at 5:30 p.m., they come out, they go back to their families, to their homes, and then they come out again at around 8:30, 9 p.m., and then our sales starts. Our sales start around 9:30 or 10 p.m., and we have the peak time from 10 p.m. to 12 p.m. So how can you expect that we'll shut our shops at 6 p.m.? So we'll be doing nothing, because that is a cultural problem.
That is indeed a cultural problem, but sir, there has to be a solution. There has to be some sort of a remedy. I'll just put this question to Paracha Saab. Human behavior, that is such a complex subject. But sir, looking at the current situation, as the spokesperson of Punjab, he was just saying that there are a lot of complications. People have multiple, point of views regarding the vaccine, as you earlier mentioned. Number two is about the kind of SOPs that need to be in place. Don't you think there should be a proper meeting with the, with the heads of the markets, like we have the president and the prime minister in almost every market, and then, talk to them, try to explain it to them, and then, make a kind of a plan. I mean, everything is possible, sir, but this has to be done, Prasad, and this has to be done on ASAP basis, because we can't afford to delay this.
No, you are right. I mean, Dr. Numan Saab and my brother spokesman from the government of Punjab, Asim Shaukat Ali Saab, they are right in a way that economic problem is there. I mean, what about those who are the daily wagers, for example, if there is a complete lockdown? And that's why this TTQ system, track, trace, and then quarantine system was innovated in Pakistan. And we see smart lockdown, like you were talking of F11 and I-84 and G62, for example.
I-10, couple of other areas also.
Exactly. That if there is some spot is emerging as a hot one, so you circle it down and minimize the movement of the people to save others. In fact, when I compare the scenario with the last year at this hour, I was in your shows many times.
Yes.
At that time, there was fear. There was a fear whether humanity could survive or not, But down the year, at least vaccine is there. At least hope is revived back, At least economic activity is going on. Limited one, I mean, if traders are saying 8 o'clock, government is saying by 6 o'clock, So there is a difference of 2 hours instead of 20 hours, for example, or 24 hours, for example, This issue was also created last year, you remember, in Karachi, that there was a massive strike down in Karachi, and traders were defiant that you take us to the jail, as Asim Shaukat Ali Saab is saying, that people have the problem, genuine
they
problem.
They were agitated, basically.
agitated in a way, the shops mostly in Karachi area, they are closed during daytime, then activity is
Starts in the evening onwards.
in the onward, till late night, and that's why Karachi is called
Even you
City
talk
of
about
Lights.
restaurants, you talk about anything.
And that's why Karachi is called City of Lights, I mean, if everything has to be done. For example, in many European cities, I've been to Brussels, Berlin, Paris, mostly I observed the businesses during day hours.
6 o'clock.
6 o'clock,
They're done.
But that's their, established tradition. Here, even in Lahore, I passed through Lahore many times, I passed through, it has been 30 years of my life that I have been passing through Lahore. Every time I passed it, whether it was 3 o'clock in the morning, 2 o'clock in the morning, 4 o'clock, I saw Lahoris eating,
Yeah.
Restaurants are,
Exactly.
in full boom, Similar is Karachi. Go to Clifton area, go to Sadr Karachi, and you will find people sitting, chatting, eating, and it's a promising life, the daytime.
That's what Karachi is known for.
That's why Karachi
That's
is
the
known
identity,
for,
yeah.
Coming to the rural areas, for example, if I go to my village, I come from near Multan, I go to my village, if I have a mask, they look at a very strange way at
As
me.
if some alien has
Yes,
come.
some alien is coming, and this is not up to the small villages, I mean, the district headquarters, for example, I see people without mask, and if someone is wearing mask.
And even if somebody is wearing, most of the people are keeping it on their chin.
So it means, that means there is a disconnect between us, the media, and the government who
And
are
the people.
propagating this message, and the people, that there is some kind of disconnect, and this disconnect has been emerging, or it has emerged
Raja Saab,
because of the early confusions.
But Raja Saab, another very important factor, and that is about the role of opposition, because I end up reading that whenever there is some sort of a pressure by the opposition on the government, how come this corona comes up? This was one of the, I'll just come back to you on that.
Just one comment, but it was also the opposition in the Sindh government. It was PPP government.
In fact, they were the first ones.
Yeah, PPP wanted complete lockdown, and the federal government was asking that how could we feed? I mean, 12,000 rupees one time cost 170 billion rupees. So government doesn't have the funds, to feed every time 12,000 rupees.
1,200 billion rupees.
Yeah.
But I don't know whether, obviously, the money will be spent. Yeah.
The opposition is not to be blamed alone, because their government in Sindh, it advocated.
Raja Saab, at the end of the day, it has to be a collective effort. Because
And-
that is
and-
the only way. I mean,
and-
they could
and-
have differences on other issues.
That's what President Dr. Arif Alvi Saab was pleading from the beginning. And today,
Interestingly, today the First Lady and the President got
yeah,
vaccinated
they
too.
got vaccinated. I think these messages
I think these are very important.
important.
Even the
Very
mother of
important.
Dr. Faisal Sultan, she got
Exactly,
vaccinated.
exactly.
Plus, we've been joined in by Liaquat Shahwani Saab, spokesperson of the Balochistan government. Shahwani Saab, Assalamu Alaikum.
Walaikum salam.
Hello.
Yes.
Ji, Assalamu Alaikum. Shahwani Saab, welcome to the show, sir. What's the update regarding Balochistan, sir?
Yes, please.
Yeah, we are doing a show on this COVID issue, sir. Things are again getting from bad to worse. This is the third wave. So we do understand what's going on in Sindh, what's happening in Punjab, again KP. Inform us about the sort of measures you have taken as far as the SOPs are concerned in Balochistan, sir, and how you're handling the situation now.
Well, compared to the other provinces, the situation is under control. In Balochistan, our cases have been increased, but 1.1% compared to last month. Last month it was 1.5% overall positivity rate, but this month it is 2.6%.
Okay.
Yesterday we took a decision that we are afraid corona is on rise in other three provinces in federal Islamabad capital territory, and people are traveling towards Balochistan. So we are afraid that this can affect the cases in Balochistan, and cases can be risen. And also the corona is unpredictable. We can expect anytime any spike in Balochistan. So that's why we took a decision that the people traveling towards Balochistan, either by air or by train or by using other means of transportation. So when they arrive here, we will scan them on a suspected basis. The passengers will be, their samples will be collected and sent to the laboratory. If someone gets positive results, so they will be in isolation, or we will send them to our quarantine center for a mandatory period. So the next question you ask about the preparations. So we have already prepared because for last 1 year we have coped with 2 waves of the COVID, and this is the third wave. We have reactivated, reoperationalized entire isolation facilities, quarantine centers. We have established 96 isolation facilities, 200 and 148 guarded isolation facilities, 68 quarantine centers across the Balochistan for 8,000 person accommodation that has been reactivated and operationalized. 57 hospitals have been dedicated for COVID patients, which has 1,103 beds, 61 ventilators also dedicated for COVID patients, and 802 dedicated frontline doctors have been posted, and they are serving the patients of COVID. As now, almost there is no patient in these hospitals, but they are on red alert, they are on high alert, and also 2,600 paramedics and 327 nurses staff. So they are serving, and we have decided that we are going to increase sample collection, and we are encouraging people, please do come and get their tests free. Balochistan government have been providing this COVID test without any fee for last 1 year. So again, we are requesting the people that please observe the SOPs, use masks, because if people want that those bitter experiences of the lockdown which we endured, that episode should not be repeated. So people have to be very vigilant about it. People have to be, they should care and also observe the SOPs. If they, cooperate with the government, so inshallah, I'm hopeful.
All right, sir.
There will not be any dangerous situation. But again, let me repeat it. As I've been, reporting these corona cases for last 1 year, so it is very unpredictable. Who knows what happens tomorrow? But again,
so all what we can do is we can follow the SOPs, and these strict sort of procedures should be in place. Thank you so much, Shavani Saab, for your...
Welcome, Ji.
Yeah. Now, coming to you, Dr. Saab, now a couple of more factors. For example, the National Assembly has been shut down for 2 days. Good enough. Will these 2 days make any difference? I'm not sure. Schools have been closed again till the 15th of the next month in Sindh, and another perhaps from 15th to another 2 weeks in Punjab also. When you talk about the transport, Dr. Saab, where there is a capacity of 20 people, they would end up fitting in 30 people. How can you expect social distancing or physical distancing in there? Who knows who has this COVID-19 positive? Or perhaps if somebody is not carrying, it's just the virus is there on somebody's hand or elsewhere. Don't you think a massive media campaign is a must now? A lot of awareness has to be there. Those people who are not wearing the mask, they should be penalized or at least perhaps punished, on some account or something, so that people should know that this is not a joke. If they are not, following the SOPs, they are being a threat to the rest of the people around them.
Yes. So Faisal bhai, so a couple of things I do want to say, so one important thing is we need to get people vaccinated. I mean, that's the only way right now, to get this over. Otherwise, every few months, lockdowns, just like Shaukat Saab was saying, it's really hard on the economy. and the lockdowns have not shown to stop the spread, because what people do, they go homes, they do parties, and they spread the infection at home. So vaccine actually, interesting part I tell you. I mean, if I have to get vaccinated again, which probably is going to be in a year, I would rather prefer like Chinese vaccine, Sputnik. Sputnik has a very good data. Means all these vector vaccines like Johnson and Johnson, Sputnik, AstraZeneca, they are actually good vaccines. No, means people actually, most of the people don't get side effects. So my
Dr.
father
Saab,
got.
Dr. Saab, we also heard that there was this vaccine, I'm not sure which one was that was actually developing these blood clots in people as a
See,
side effect
yes.
perhaps?
Yes. So as soon as we have millions and millions of people vaccinated all over the world, there are side effects. Means there are side effects, but if you take the total number of people vaccinated and the total number of side effects,
Yeah, that's
they are
minimum number.
2 or 3 in million. So
Yeah.
they're not that much that we get scared. But the problem is
Okay.
on the other side. So field of medicine is risk versus benefit. So there is a risk of even taking a paracetamol. You getting me? You can kill your liver. But the question is, what is the benefit? So the benefit weighs the risk. So that's why we need to explain to the people the vaccine, we're not going to become some kind of an animal with vaccine. The vaccines, we have to get the vaccine in, because this is a new virus, no immunity against it. As soon as you get vaccine, either it's the Chinese, either it's Johnson and Johnson, AstraZeneca, Pfizer, anything, this will give body an immunity, which is the body against that the spike protein. Once you have the immunity, once you have the antibodies, whatever the strain it is, at least you will not die, at least you will not be hospitalized. But one more thing, I mean, Prashad, a really interesting thing, I do want to compare United States with Pakistan. I mean, Pakistan has done a lot of positive things. Allah has helped Pakistan a lot, no doubt about it. But the government has done also very good things too. Means these smart lockdowns means there is a problem of economy. There is a people who are, we call our daily labor. I mean, if you ask them to sit them at home for 2 months, what they're going to do? So, but the people need to understand one thing. So, interesting part which I want to compare is like, so after this lockdown finished in July, I live near, close to very like 3 miles away from Disney World. So I start going Disney every week because we were like stressed out, and I went to Disney more than for last 10 years I've been there. So, but interesting part was the park has a capacity of like 100,000 to 150,000 people. But everybody understand. Now the people need to, I'm telling it to the people, not the government. Everybody's wearing a mask. People are staying away from each other. And even if we have sanitizers in our pockets, you touch something, it's contaminated, you use sanitizer. And
Correct.
so why I'm saying this, you can do everything in your life if you just follow the SOPs. You
Absolutely,
don't the
Dr. Saab.
government, the government does not have to shut down the shops at 6 o'clock, honestly speaking.
Dr. Saab, a quick comment because we're running out of time and I have to
Yes.
also take a comment from the other guest. But sir, there was this case that even in one of our colleague, I mean, he got COVID positive, then he recovered. But now recently I spoke to him last night, Dr. Saab, he says that his body is like, it has no energy left. He can't even stand up. And he's a good fit young guy who runs, I mean, who does regular running and all. And he says he can't even get up, and the kind of pain he has in his vertebra, that's unbelievable. He says, I can't stretch myself, I can't even lie down straight on the bed. So how come a person who has already had COVID ended up getting it again, and in a very worse way?
You can get it again. It's a coronavirus. Regular coronavirus is like sore throat virus. You get it every year. Every winter you get it. So this is a coronavirus. Again, people need to understand. You got it 6 months ago. You have antibodies for 6 months. You can get it again. And some people have got it, and some people have actually got it very worse the second time. There are people who actually died getting it second time. So that's what I'm trying to say. That people, you can do everything. You can do shopping. You can go outside, but you have to behave. You have to like SOP, you put your mask, stay away from other people. Honestly speaking, you can do a lot of things. The government does not have to shut down, and the economies don't have to suffer. Only people
Absolutely.
have to understand.
And Dr. Saab, Ramzan is right around the corner. Today is the 1st of Shaban, and then right after 1 month we'll be having Ramazan. And I think the government should be geared up properly to look after the effects, and this is not going to go away in 4 weeks or so. So let me put this question to you, Asim Shaukat Ali Saab, like what exactly is the government thinking? Forget about today and tomorrow. I'm talking about, as you mentioned, this is going to be a continuous story, sir.
Faisal, three things I would like to wind it up. First of all,
Sure.
yes, I absolutely agree with you. Faisal, we not only need to spread awareness among the masses, but at the same time, we also have to counter the false propaganda, the disinformation that is being spread by different elements in the society. Number one. Number two, Dr. Numan Saab has very rightly remarked that we should try to vaccinate people as maximum as possible, and we already have in our mind that by the end of this year, inshallah, we'll be able to get 70% of the population vaccinated by the end of this year. Number three, I would like to take an yes, by the end of this year. Okay. Number three, I would like to take an advantage of the presence of my elder brother Shaukat Paracha Saab over here, and I will do little bit of politics. If you remember, last year, the opposition political parties were hammering us like anything that why don't we go for the complete lockdown? Why don't we go for the complete lockdown? And we were of the opinion that people's economy is at stake, so we will go for the smart lockdown, TTQ technique. And they were like, and you saw that in the second wave of the corona, they were inviting people to the massive gathering just for the sake to protect their corruption, their looted money, their plundered, their money laundered, the money they laundered to the. So this is extremely. I just want to take this opportunity from your platform to let people know that this is highly irresponsible behavior on part of the opposition. So they should also behave responsibly because they provide leadership to the people. Now
exactly,
coming to your point, Faisal, yes, thank you,
yeah.
Thank you.
No, this is very
Firstly,
important.
Government, yes, government is trying its level best. We spared 208 billion rupees through SHAS program. It was an automated program. We distributed every single penny on thumb impression. There is no problem from the people that we did not oblige only people from our party. It was across the board. We did everything we could have done. But at the same time, this is also a responsibility of the people to respond positively. This is the responsibility of the people to understand that their own health is at stake. This is the responsibility of the people to realize the gravity of the issue, and
I
they
totally
should
agree
learn
with you.
to live with this virus. Yes,
Absolutely.
And they should start observing the SOPs because it is for their
Absolutely,
benefit.
absolutely. I'm so
In
sorry I have to
countries
cut
like
you here, sir.
Pakistan-
Prasab, we are totally, sorry, Shaukat Saab, we are totally running out of time. But thank you very much for your comments. But I'll just quickly say one thing, that definitely it is responsibility of the people of Pakistan. But having said that, the responsibility of our leaders also. This needs to have a collective effort. Forget about the kind of differences you have on political grounds. But when it comes to the people of Pakistan, we need to be united. But thank you very much, Ali Shaukat Saab, Dr. Numan Saab, Shaukat Paracha Saab, was a pleasure having you. And that's all we have for this hour. I'll see you tomorrow, inshallah. Till then, you take good care. Khuda Hafiz.